Hello, welcome back. I'm Michael Wales, also known as the Child Injury Attorney. Today we are talking about something every parent, caregiver, teacher, and coach should understand: traumatic brain injuries, also known as TBIs, in children.
When your child is injured by negligence, Michael Wales fights for justice. The Child Injury Attorney.
Brain injuries are often called invisible injuries because the damage isn't always obvious, yet they can have lifelong consequences. According to the CDC, the Centers for Disease Control and Prevention, traumatic brain injuries are one of the leading causes of death and disability among children in the United States. In today's podcast, we're going to break down 5 key topics about TBI: what a traumatic brain injury actually is, the most common causes in children, symptoms to watch for, why children's brains are uniquely vulnerable, and what to do if you suspect a brain injury. So let's get started. A traumatic brain injury happens when a sudden bump, blow, or jolt to the head, or a penetrating injury, disrupts normal brain function. TBIs range from mild, commonly called a concussion, moderate, to severe, which can involve prolonged unconsciousness or significant neurological impairment. In children, even a mild concussion can interfere with learning, behavior, memory, and emotional regulation. Now let's talk about the main causes of TBI in children. The causes of TBIs in children vary by age group. Falls are the leading cause of TBI in children, particularly toddlers falling from furniture. Playground injuries, falls downstairs. The CDC reports that falls account for nearly half of TBI-related emergency visits in children. There are also sports and recreational injuries, including activities such as football, soccer, and hockey, amongst others. Concussions are especially common in adolescents participating in athletics. Other causes are related to motor vehicle accidents. Car crashes remain a major cause of severe TBIs in children, in particular when seat belts or car seats are improperly used or not used at all. There's also physical abuse, which is considered non-accidental trauma. In infants, abusive head trauma, sometimes called shaken baby syndrome, is a serious and often fatal cause of TBI. If your child has suffered a traumatic brain injury due to someone else's negligence, my team and I can help you seek justice and compensation. Please visit our website for more information, thechildinjuryattorney.com. Now, let's talk about the symptoms of traumatic brain injury in children. Symptoms of TBIs can appear immediately or hours to days later. Be aware of the following signs. In babies and toddlers, watch for excessive crying, refusal to eat, vomiting, changes in sleep patterns, bulging soft spots called fontanelle, or irritability or lethargy. In school-age children, watch for headache, nausea or vomiting, confusion, trouble concentrating, dizziness, sensitivity to light or noise, or mood changing. Now, these are the emergency warning signs. Seek immediate medical care if a child has repeated vomiting, worsening headache, seizures, slurred speech, weakness or numbness, unequal pupil size, or loss of consciousness. The American Academy of Pediatrics emphasizes that any concerning change in behavior or neurological function after a head injury warrants evaluation. Now, let's talk about why children's brains are more vulnerable. Children's brains are more vulnerable because their brains are still developing, more susceptible to rotational forces, and structurally softer and less myelinated. Research published in the Journal of Neurotrauma indicates that pediatric TBIs can disrupt long-term cognitive and emotional development because the injury occurs during critical developmental windows. Additionally, children may struggle to communicate symptoms clearly, especially younger ones, leading to delayed diagnoses. While many children recover fully from mild TBIs, others may experience long-term effects such as learning disabilities, memory impairment, attention problems, behavioral dysregulation, and increased risk of depression or anxiety. Some studies have found that even mild TBI in early childhood was associated with later behavioral challenges. Repeated concussions increase the risk of cumulative neurological damage. There are ways to prevent TBIs. Here's what caregivers can do. Use properly installed car seats and seat belts. Ensure proper helmets are worn for biking, skateboarding, and contact sports. Supervise young children on playgrounds. Install safety gates and window guards at home. Follow return to play protocols after sports concussions. Please subscribe to our YouTube channel to receive more valuable information like this. We also appreciate your feedback, so please leave us a comment. Now, let's talk about what to do if you suspect a brain injury. If you suspect a brain injury, you should do the following. Remove the child from the activity immediately. Monitor symptoms closely. Seek medical evaluation. Follow return to learn and return to play guidance, and never allow same-day return to sports after a suspected concussion. And remember, early management significantly improves outcomes. Traumatic brain injuries in children are common, but many are preventable. Recognizing symptoms early, seeking medical attention promptly, and taking prevention seriously can protect a child's developing brains. Young minds are incredibly resilient, but they're also incredibly precious. If today's episode was helpful, please share it with another parent, coach, or educator. Until next time, stay informed, stay safe, and take care of the brains that shape our future.
When your child is injured by negligence. Michael Wales fights for justice. The child injury attorney. Justice and protection for injured children. Thank you for watching. This presentation was brought to you by Every Media Productions.